Namaste everyone. Welcome back to live stream session. So today I'm going to discuss about the Navajata Shishu Paricharya in our Ayurvedic term, which is meant by the basic care of newborn, especially new mothers, first time mothers, or not only first time mothers. Every time when the mother give birth to a baby, her experience will be different, right? And whatever the problems or issues of a baby, or maybe the taking care of a baby, will be new to her and different to her, because babies will differ. Maybe the features of babies, or maybe the problems of babies, health, taking care of babies will be different for every babies, right? So our mothers will be in a question mark that what to do, when to do, and how to do. So today's my topic is about the basic care of newborns. Especially newborns means, according to our modern term, the newborns are known as like neonates. Especially the medical term, technological term is used as neonate. From birthday to 28 days or 1 month, the baby is known as neonate. Whereas in our Ayurvedic term, the Navajata, that is from birthday to 120 days, our Ayurveda considered a baby as a Navajata. So we'll see according to our Ayurveda what all caretaking procedures they explained. Nothing but our Ayurveda is ancient Ayurveda, as the name only suggests it's ancient Ayurveda. What all our ancestors follow the rules and regulations in taking care of a baby, same has been explained according to our Ayurveda. And some tips after explaining the procedures, some 10 to 12 tips I'm going to give for new mothers to in taking care of their babies. So let's start the topic. That is, according to our Ayurveda, as I said, it's Navajata Shishu Paricharya. And according to our Acharyas, this Navajata, as I said, it's still 120 days. They divided the condition of a baby, or this procedures of a baby in different three forms. That is Jata Matra Sishu, Sadhyo Jata Sishu, and Navajata Sishu. Whereas Jata Matra Sishu is only from birth till cutting of umbilical cord. What the 10 to 15 minutes the baby will be in labor room, or if it is C-section in OT, that time is considered as a Jata Matra Sishu. And the baby from birth time till 24 hours, it is known as Sadhyo Jata Sishu, means newly born baby. And as I said, till 120 days, from birthday to till 120 days, it is known as Navajata Sishu. And our Acharyas explained different types of procedures to taking care of a baby. As in Jata Matra Sishu, as I said, it's still only cutting of umbilical cord, or in any work will not come here. Only the work of a physician or pediatrician will be here, because as the baby will be still in their hand. But still, I'll mention what all procedures they have to do, so that you will be having knowledge about it. In Jata Matra Sishu, that immediately after birth till cutting of umbilical cord, what all will come? That is resuscitation. If baby is having any respiratory issues, like baby is not able to breathe, you all maybe heard the complaints, right? Your baby had a aspirated the mucus, or aspirated the motion, so it is not able to breathe. Some complications. All babies will not be perfect, right? In 100, nowadays almost 50 to 60% newborns are having respiratory infections or respiratory blockage after birth. So again they will shift to NICU in taking care, right? So these all, the clearing of airway, especially the respiratory system and cardiovascular system, stimulating it and making it normalcy. This procedure is known as neonatal resuscitation. In our Ayurvedic term, it is known as Prana Pratyagamana. This will come under Jata Matra Sishu. And next is Ulbashodhana, means nothing but our Ayurvedic term is Ulbashodhana. Here in modern term also we will see, like they will clear the suctioning. Whoever have the medical knowledge or medical related to medical field, they will be knowing immediately after birth they will suction the baby. They will clear the baby artificially through suctioning machine, or before they were using suctioning bulb they were using. They will clear the airway, because as we know, the womb will be filled with amniotic fluid, and the all fluids will be filled, or while giving birth, while moving in a tract, vaginal tract, it maybe had a blockage. So they will clear the airways, maybe nose, mouth, everything. For this they mentioned as Ulbashodhana, and some other acharyas, like we have varieties of acharyas, like different acharyas. Some acharyas mentioned that cleaning, you all may be heard or seen that baby will be covered with, baby's newborn skin will be covered with white type of paste, that we in medical term it is known as vernix caseosa. According to some acharyas, they say that the cleaning this white paste, that nothing but vernix caseosa, is the procedure known as Ulbashodhana. Then next is Mukha Vishodhana. In this same thing, what are these medical terms, or the physicians or caretakers will do, they will clean, they will take a swab in a finger, and they will clean all the mouth and nose, like we clean the mucus, they will clean all the airways or tracts, or nothing but cleaning the channels. Then Garbhodaka Vamana, even olden days they were doing this, right? Has babies babies will be aspirated the fluids or the mucus. What they were doing in olden days, it was practice, but now it is not practice. They will make the baby to lick salt, Saindava Lavana and Grita, so that due to Lavana, the baby will vomit whatever aspirated. In olden days, it was in regular form, because in olden days they were not giving birth in hospitals also, though, so this suctioning and all was not there. So they were practicing this. But nowadays it is not advised to do this, because what it will create the artificial pressure to the baby to vomit it out, right? So it will hamper the baby's health. So the pediatricians are not advising this, and they will not support this. But in olden days it was followed. And last one is Nabi Nala Chedana. Nabi Nala Chedana means cutting of umbilical cord. Obviously we all know, and for your knowledge, the umbilical cord is the main root cause to move the all nutritious, or maybe indirectly it is the pipe to connect from the mother and fetus, nothing but baby, right? So after coming out of a baby, this umbilical cord will be cutted, and no need to touch it or do anything for it. Hospital people will cut the umbilical cord, and they will be clamped with the umbilical cord clamp. It will remove by itself after 1 week or 7th day, or after 7 days it will remove by itself. So no need to do anything for this. But in before days, like as this technology developed before, however they were doing the delivery in home, they were smearing some medicated oil or balya oil to cure this, or Dupana Karma they were doing. But nowadays it is not, again, as I said, it is not followed. And here another thing, when I'm explaining about the olden days system, for Prana Pratyagamna, how we have the technology developed, and we have different kinds of suctioning and cleaning, and the respiratory cleaners, everything we have. But in olden days, what they were doing to stimulate this respiratory system and cardiovascular system, they were streaking a stone near the ear of a baby, and they were smearing cold water in summer and hot water in winter to stimulate a baby's respiration. And they were fanning with the Krishna Kapalika Surpa, means this fanning material will come in villages. Now also we will use this, right? So they were fanning to stimulate, nothing but to stimulate the baby, and by stimulating the baby will start its respiration vigorously. So this was about the Jata Matra Sishu, that is the baby immediately after birth till cutting of umbilical cord, what all the procedures they will carry out to take care of a baby in OT or labor room. After this, our caretakers or guardians or your parents work will come, that is Sadyojata Sishu. The baby from birth time till 24 hours, the baby is known as Sadyojata Sishu. What all procedures will come under this? Here comes the guardians activities. Like in Sadyajata Shishu, they mentioned Taila Parisheka. Taila Parisheka is nothing but Abhyanga, massage, the oil massage to a baby. Then Snana, nothing but bathing. Pichu Dharana. Pichu Dharana is nothing but oil filled cotton will be kept on head of a baby. And Udaka Kumbha Sthapana. Actually, this Udaka Kumbha Sthapana, in olden days, they were doing this to maintain the temperature in a room. And first day prashana. Even this prashana means leaking some honey and grita to a baby. Even the nowadays, in these days also, some people will follow, but pediatrician or physician will not advise for this, especially in in modern hospitals. But in our Ayurveda, it is followed. Now, one by one, we'll see what is this Sadyojata Shishu Paricharya. That is, what all these procedures, why we want to do this. As I mentioned, this Taila Parishika Snana, from olden days we are doing this, right? But our ajis or our grandmothers or many elderly people will say to do this, so we are doing, but we don't know the fact that why we should do this, right? What is this Taila Parishika? As in Dinacharya also we saw massaging with the oil, right? Nothing but it will stimulate the circulation, it will enhance the functioning of skin, and it will make the baby nourished. And main thing is, as the delivery process is very difficult one in moving through channels and coming out, baby's body will be like it will be taking place of many process to come out. So the baby will be having very pain, one thing. And as we massage our body, the baby muscles will get nourished very nicely. So what we should do, however, in hospital they will not allow to do this. After coming home you can do, but according to our acharyas, you should start this immediately after birth, when babies comes to normal stage with respiration and cardiovascular system normally, then you can start this. But in hospitals they will not allow, they will do only sponge bath after coming home next day. If normal delivery, next day, or if cesarean, when you are when you will be able to go home, you can start this massaging the baby with balya dravyas, especially like Shirabala Taila. It is one of the balya taila. By massaging, or if you're not affordable to take a particular medicine, normal coconut oil you can use, but you should not use directly cold oil. You should heat it indirectly, then you can take it. Because if you massage the body, not even only for newborns, even for elders, if you are massaging, if you're doing the massage, you should heat it indirectly, then only you should massage the body. Because if you are massaging with the cold oil, then it will catch the abhishanda, what we say in Ayurveda. That is, it will catch a cold, it will not nourish, like it will not become this stability to the muscles. So you should use the warm oil, that too how indirectly heated, because if you heat directly any oil, it will lose all its properties. So indirect heat means you can take a water in a big bowl, you can boil the water, and you can take a oil in small bowl, and you can rotate on the hot water, so that it will become indirect warm. Then that oil you can use for the massaging of a baby. Then after massage, obviously by leaving 10 to 15 minutes gap or 5 to 10 minutes gap, you can make a bathing. You can make bath a baby. In bathing also, in this, one mistake our grandmothers will do is they will add very hot water. It is not advised, because the baby, if the baby is not able to tolerate a very hot water, it will, as the baby's skin will be very sensitive, it will harm the baby's skin. So take a normal warm water, not too hot or not too cold, which the skin stability can control of a baby. You can take that much of hot water, and you can make the baby to have a bath after Taila Parishika, that is after massage. What is this Pichu Dharana? Pichu Dharana is nothing but, now also we will follow this, right? You can take a oil, same normal coconut oil, warm coconut oil you can take, and you can dip a cotton and you can keep on a baby's head. Why we should do this? Why our grandmothers will do this, or why our ancestors were doing this? Obviously, as you all know, the baby will be having anterior fontanella and posterior fontanella. But posterior fontanella will close within a month, but anterior fontanella will be open nearly 18 months to 2 years. After 2 years only, or within 2 years, it will get closed. What is this anterior fontanella? There will be gap between the ossification or closure of the skull bones. This gap is known as anterior fontanella. To maintain this, because if any injury or if any external foreign bodies attack to this fontanella may cause brain infections. So to maintain it safely and to close it quicker in normal form, we will use this pichu dharana. That is nothing but coconut oil or any other oils, whichever you are using for abhyanga or massage. You can take that oil and you can have you can pour on the anterior fontanella, or you can dip like cotton you can keep in a dipped oil. This is pichu dharana. And next one is udaka kumbha sthapana. What is this udaka kumbha sthapana? As I mentioned, in now we has technology developed, we have plenty of options. Like in summer we have ACs to maintain the room temperature, and in winter even now we have warm ACs to maintain our room temperature. But in our ancestor days it was not present, right? So to maintain the room temperature, they were using this udaka kumbha sthapana, nothing but in earthen pot. They were filling the pot full of water and they were keeping near the head of a baby. In summer they were using cold water, and in winter they were using hot water, nothing but to maintain the temperature. That's it. Then prashana. What is this prashana? Actually, this prashana or swarna prashana bindu have many benefit effects on newborns. We will have a separate session on this. But overall, now what is prashana? Licking a semi-solid thing to a baby is known as prashana. And what we are doing here, actually, some, even I saw in my relatives, some people will follow this. What they will do, they will dip a finger in honey and ghrita, and they will make the baby to lick it. Nothing but prashana. Immediately after birth, if you do this, it will enhance or it will stimulate the gastrointestinal plexus, so that the baby will pass the meconium as soon as possible. What is this meconium? The baby will, you all may be seen, the baby first stool will be black in color. That is nothing but meconium. By licking this, it will stimulate the gastrointestinal tract, and the baby will pass the urine or meconium as soon as possible. Because according to the taking care, the meconium should be passed within 24 hours after birth. So to pass this meconium as soon as possible, we will stimulate the gastrointestinal tract by prashana. This was about the Sadyojata Shishu Paricharya. Now coming for Navajata Shishu Paricharya, that is from birth till 120 days. From birth till 120 days means obviously this 24 hours procedures will be included. Then after this 24 hours procedure, what all we can take care according to our acharyas, that is prashana after first day, and stanapana, raksha karma, and nishkramana. These all procedures will be included in Navajata Shishu Paricharya, that is till 120 days. Because why till 120 days the acharyas considered as Navajata? Because in nowadays we are not having time, and even we will not get leaves for working women, so they will finish these procedures in 20 to 30 days and they will go out. But in olden days they were following this Sutika Paricharya, that taking care of delivered women and taking care of newborn. They were considering till 3 months. After 3 months only they were taking the baby for outing or out of Kumaragara. That is what the room was prepared for newborns. They were taking out from it after 3 months only. But nowadays in 3 months the baby will roam whole city. That's the other matter. But we will see now what is this prashana. What is Stanapana, what is Rakshakarma, and what is Nishkramana. What is this Prashana? As I said, it is leaking of semi-solid thing. Nowadays, we have plenty of options. If breast milk is not sufficient, or the breast milk is not coming for new mother, then they will go for formula milks. However, we are getting prepared one, like we can add warm water and we can give. But in olden days, it was not possible, and it was not present also, right? So what they were doing, usually women in 100, only 40 to 50% women will get a breast milk immediately after delivery within 2 hours. But most of the women will not get breast milk till 3rd day or 4th day. So how about the baby till 3rd or 4th day? So according to our acharyas, they mentioned 4 days prashana, by giving honey and grutha, with mixing this honey and grutha with medhya drugs, so that they can cure, or they can cover the hungry of a baby without the breast milk, and they can stimulate the brain functioning of a baby with medhya drugs. They added, while explaining Prashana topic, I'll explain what all drugs also, herbal drugs they used, just for your knowledge here. For 3 days, they will give this honey and grutha with other medhya drugs, and especially in some part, they added even gold, Swarna Bhasma, to stimulate the brain functioning of a baby. And Stanapana, obviously, Stanapana is breastfeeding. What we have to do here, we should advise a new mother that feed a baby immediately after birth within 2 hours. Though you get a breast milk or not, you should wash your breasts, and you should give a baby nipple in baby's mouth, so that if the baby licks a nipple, then it will stimulate your plexus, and it will as soon as possible you will get your lactation or breast milk. So and another thing is, your first milk will be thicker form and yellowish form. Don't think that it is not a milk, so you should throw this. You should not do that, because it is a first shot of vaccine to a newborn. It is nothing but colostrum. It is very good. Now in animals, how we eat cow's colostrum, we will say it ginna, right? So like that, it is the new mothers also will get thicker form of milk in starting 7 days. It's very good for newborn, so you should not throw that, or you should not remove it or express it. You should give immediately after birth, within 2 hours. You should make the baby to suck the nipple, so that it will stimulate your glands also, and secretion will take place, or lactation will start as soon as possible. And after getting milk, for every 2 hours of duration, you should feed a baby compulsorily, not before 2 hours and not after 2 hours, because you can leave a gap minimum to 2.5 hours or 3 hours, but within for every duration of frequently every 2 hours, you should make the baby to feed. And last one is Nishkramana. What is this Nishkramana? According to our acharyas, and we have kinds of samskaras, nothing but cultural ceremonies. In that ceremony, this Nishkramana, in that samskaras, Nishkramana samskara is one of the samskara. In this Nishkramana samskara, what we are going to do is, as I said, in the olden days, in our acharya's concept, the newborn care was taking till 3 months. So after 3 months, the baby was made to come out of Kumaragara, that is nothing but the room, caretaking room of a newborn. Why they mentioned only after 3 months? They can take in 1 month also, or they can take after 5 months also. Why only 3 months? Because after completion of 3 months, the baby's sense organ, especially the ears and eyes, will start to functioning. So the one way to examine ear and eyes also, the acharyas plan to do this Nishkramana samskara from after completion of 3rd month, or in 4th month you can do this. That is taking out of baby from Kumaragara. You can take the baby out, like obviously in our olden days, they out means they were taking a baby to temple, take a blessings from elders, and sages or god and take the baby back to home. This procedure is named as Nishkramana Samskara. So this was about our especially our Ayurveda, what all newborn care we should do. That is Navajata Shishu Paricharya. From the time of birth till 3 months, what all procedures you have to follow and what all um, tips you can follow, like Taila Parishika or Pichudharana, you can do. The taking care of a newborn is explained. Now, after this, some tips for especially for our new mothers I want to give. That is, has immediately after birth, as I said, you should breastfeed a baby for every 2 hours, and don't feed a baby within 2 hours or before. You can feel that, right? If the baby is having comfortably stomach full breast milk, then no need to go for um, frequently breastfeeding, like maybe within half an hour or within 1 hour. Don't feed that, because if the baby is crying, it will not cry only for feed. Maybe the baby is having some colic pain, or the baby's posture, you can see bed posture, it may be hampered, or if baby is maybe feeling uncomfortable, or baby maybe wanted to take baby in a lap, so baby may be crying. So don't confuse that. If baby is crying, the baby want feed, you will go on feeding, because if you feed within 2 hours, it will not digest. Obviously, like our elders, if the previous meal is not digested and if we have again meals, obviously it will hamper our agni, digestive power, right? Same thing in babies. If you feed frequently, it will not get digested correctly, and again the baby may will have colic pains or other gastrointestinal problems. So feed a baby within duration of 2 hours. If baby is crying within 2 hours, then go for other queries, like maybe bedding or any uncomfortable in the health or any other colic pains you can see. And another thing is about umbilical cord. You should take care, especially these 7 days. You should take care of umbilical cord. If you are using a diaper, you should leave a space of that umbilical cord clamp, because this umbilical cord needs 7 to 8 days to dry up. So you should wait for dry up, and you should maintain dryness around the umbilical cord so that it will dry up soon. And after 7 days also, when the cord clamp falls down, you should not apply anything to that. You should make it. You should keep it dry, and especially moisture should not be present after bath. Neatly dry up umbilical cord, so that if this umbilical cord had infections, again it will react on the health of a baby, and it will have the complications. And next tip is eye care. Eye care, what you can do, like not all babies, but some or few babies will be having stickiness of eyes, especially in this newborn period, first 1 month. Stickiness of eyes may be, or watering of my eye may be present. What you should do, it is a natural process. If it is within 1 month or 30 days, you can clean a baby. How you can clean baby's eyes? How you can clean? Dip a cotton in warm water and clean a baby's eyes from medial to lateral. Never take or clean from lateral to medial, because as you move here, the dust or any infections will settle here, and it will create the infections. Always clean a baby's eyes from medial to lateral with warm water and cotton. And Don't do this, and don't pour any breast milk or drops to the babies. And next thing is about nose, clearing the nose. What you can do here, that obviously how now babies will be kapha prakriti, more predominant of kapha, so the mucus will collect in nose. Repeatedly you can clear the mucus from the nose. And why we should do this? Because obviously the babies will collect the mucus frequently. Some children will continue this till 5 years, or some children will continue this till 6 to 7 months, then they will be clear. Just always clear the nose, because the babies can breathe easily, that's it. And another thing for babies cry, maybe this is also reason, that is blockage of nose. So take care of the nose repeatedly or frequently, see whether it's blocked, you can clear this. And next thing is about sleep. Many mothers will be having complaints that my baby is not sleeping continuously, or baby will get up very soon. Actually, first 3 months the baby's sleep will hamper frequently, and the baby sleeps here 16 to 17 hours a day, first 1 month especially. Then later, as baby grows up, the time of sleeping time will reduce, and after 3 months the baby will, as I said, ear and nose stimulation will take place. Obviously the baby will start awakening for more time. So uh, approximately calculate a baby's sleep, how many hours a baby slept. If the baby is sleeping more than 14 hours in a newborn, and later has time reduced, it's normal. They will not calculate hours, how many hours the baby slept, but they will be like, if baby is having sufficient sleep of 15 hours, obviously the baby will not sleep. But our mothers will not calculate hours, they will feel that the baby is not sleeping in a day, or if the baby slept on a daytime, the baby is not sleeping in a night, they will have the queries. And in sleeping you should see about the positions of a baby, how the baby is sleeping, because in supine position the baby will be comfortable. The side position also is comfortable, but should see about the obstruction to the nose. And about swaddling a baby makes the baby to stimulate or to sleep sooner, because the baby will feel warmthness in a swaddling. And about co-sleeping is very good to our newborns, because it will be having skin to skin touch, and the baby will be comfortable beside the mother. But again, see here about the obstruction or any hamper to a baby in your deep sleep. Then next thing about the burping, especially first I want to mention this, because immediately after every feeding you have to burp a baby. You can take a baby in straight position, and you can rub in the back, so that the baby will because the babies will swallow air with the breast milk while feeding. So to remove this air out, we should do the burping, so that the baby will not have any regurgitation. If you didn't do burping after every feed, the baby will vomit the milk. This is also the common complaint of mothers, right? But if you do regular burping, the babies will not have vomiting of milk. The next thing about vitamin supplements, like vitamin D, obviously our pediatrician will advise. Why we need this? Obviously, has the baby's organs or every functioning, every part will get its functioning according to age developed. First 3 to 6 months the baby need extra supplements of vitamin D to make the functioning sooner or in normal way. So we should give this. And next thing about the products, uh, because every new mother will be having a big question that which product I should use for our baby. See, because I can advise the products which I am using for my kids, but it may be suiting my kids and it may not suit for your kids, right? So always test a small sample of any product on your baby. If it is suiting a baby, if it is giving a good result, then you can move further. because a same product will not work on all babies or all issues, right? So whatever you are using a product, first have a test on your baby. If it is not having any complaints, then you can move further. And about dressing here comes the warmthness of a baby. Keep a baby, especially newborns, warm, because they will be very sensitive. And obviously, preferably use a cotton cloths for babies, so that the skin will be very sensitive, so they will not cause any harmness to the baby. And next, coming for total care of a baby, that is uh, scheduling your baby's sleep or feeding, anything. As a newborn will be very new to environment. However you are giving protection, or how you are giving the routine, it will follow, same will be followed. If you are giving feeding for every 1 hour, obviously the baby will get addicted to it, and baby will ask feeding for every 1 hour. So you should not only in feeding, maybe sleep or activities of a baby, everything, how you make a baby to do, the same thing will be followed. So it's in your hand. You can you should make your schedule and make the baby to uh, uh, follow up on the same activities. And last thing about the weight. Obviously all will be having question that my baby is getting more weight, or my baby is not gaining weight. Immediately after birth, till 7 days, whatever the baby is having weight, it will reduce its weight, because it should adjust to new environment outside the womb, right? After 7 days, again the baby will gain weight approximately 30 grams per week. So don't get confused with the birth weight and after a week birth weight of a baby. And another thing is, birth weight should be doubled at completion of 5 months, and it should be triple after completion of 1 year. If the baby is following this ideal weight, then no need to worry. And don't get confused that other baby is gaining more weight, my baby is not gaining weight, anything. Yeah, if the baby is following this double and triple its weight till 1 year, then obviously the baby is gaining good nutritious weight. So this was the basic, and still more points is there to explain, but time is running out. And also the if we start to explain particular points, it need a session to have separate session to explain it. So we'll have a separate sessions for particular points. So this was the just basic points, how you can and what all you can take care of a newborn. If you have any other topics to discuss according to taking care of a newborn, you can comment in a comment section box. So we'll have a separate session on particular points. Thank you.